The particular study that we focused on was a study called Keylargo. It was a phase 2 study in gastroesophageal patients. It was single arm, 36 patients. And it was really impressive with regards to the diversity of responses. Some patients had complete responses where their tumors were unmeasurable for up to 3 years and came off study, while other patients quickly progressed and came off study. With regards to the tumor-informed assay in the panel that we're looking at in this particular case, the Next Personal will have up to 1,800 variants. It really drops the sensitivity. I believe in our assay, in our study, it was close to 3 parts per million. So I think from the field perspective, as we all look at circulating tumor DNA and other biomarkers that might help patients, thinking about identifying a molecular phenotype that tells us the patient is no longer responding to therapy. And I think that as we continue to get more validated assays and confirm this in multiple data sets, hopefully we'll begin to accept molecular progression as a standard measure for patient response, working with radiographic or perhaps displacing radiographic measurements. Looking at what value does ultrasensitivity truly provide compared to other base technologies that are out there, getting down close to that single-digit parts per million. What we saw were changes in that low level where it would be below the limit of detection in certain assays. In the Next Personal assay, we were able to pick up these small changes, again, allowing us to identify molecular progression at an earlier time. We would have missed these particular patients' progression, molecular progression, using more standard technologies. So of course, I think by capturing those patients and calling them positive progressors and lining up with what radiographic data showed us later in therapy, using those 6 or 7 patients that fell below the line of limit of detection for the standard assays where we were able to pick that up, really helped the power of the study. Without those 6 patients, we may not have seen the dramatic effect that we saw with regards to clearance as well as change over time of the ctDNA. So clearance meant improved progression-free survival and overall survival. So it was a very significant outcome, and ctDNA clearance, I think, will be one of the outcomes we need to think about with regards to molecular progression. Yeah, so I think that's the core of this technology, is the advance in identifying patient progression, right? And molecular progression compared to radiographic progression by RECIST. And I think that the month, 2 months, and some patients even more, that allows a therapeutic window for us to intervene in these patients that may be responding at a very early time, perhaps providing a better therapeutic window, better therapy options, and better responses for our patients. And I think this is one of the main advantages of this technology and the ultrasensitivity the Next Personal offers, is to advance that lead time to help patients at a time before their cancer has already gotten to radiographic progression and perhaps not as sensitive to the next line of therapy. In the setting of MRD, I think sensitivity is very important, in using an assay like Next Personal that has exquisite sensitivity, some of the best in class. That would be a very good choice.